Meantime, the former president's diagnosis is sounding the alarm to men to take care of their health. 17's Robert Price talked to two local experts on the prevalence of prostate cancer among American men and how it can be prevented and treated.
Americans have largely rallied around the threat of breast cancer, but we don't seem to see the same level of concern when it comes to prostate cancer. Why is that? And could President Biden's diagnosis change that? One would hope. The former president's diagnosis is yet another reminder that cancer is not impressed by power, money, or notoriety. And screening for prostate cancer is so simple. It's the unwillingness that's the downfall for many. We all know what that pink ribbon means, but this uniquely male malady, not so romanticized, if we can use that term. Some may be surprised to learn the two cancers are related. Dr. Ravi Patel has been treating various cancers throughout a distinguished career at the Comprehensive Blood and Cancer Center on Truxtun Avenue in West Bakersfield.
1 in 8 women will get breast cancer. Roughly 9 will get prostate cancer. But there is a connection, and a very deep connection, and that is that certain genes, which are called the BRCA genes, are found also in prostate cancer.
Which means, since those cancers can be hereditary, a family history of breast cancer can be an indicator of the increased threat of prostate cancer, and vice versa. Leonard Sosowski's life was dramatically impacted by prostate cancer years before it actually invaded his body. His father, Leonard Sosowski Sr., was diagnosed with prostate cancer at the age of 55, and he died from it at age 57. Now Sosowski himself is a 13-year survivor of the all-too-common growth that attacks the walnut-sized male reproductive gland. More than a survivor, he is a vocal proponent of vigilance. Problem is, many men would prefer not to think about the nether region where the prostate resides, never mind endure the quick and painless but somewhat notorious screening. But he's a big advocate of the digital exam and of the complimentary PSA blood test. It saved his life.
I had mine. It came up at the age of 49. At 50, I was diagnosed with it. Very early on, very fortunate because of the PSA test, which caught mine early, and I chose to have a radical prostatectomy because I'd seen the other side and decided that I wanted to take it out, and 13 plus years now I've been here.
When is the right time to get one's first screening?
I would definitely by 50. Yeah. Just get a baseline. That way you sort of know where you are.
Moral of the story? Get a simple and painless PSA screening ASAP, guys, if you haven't done so recently, and pay attention to the risk factors of this highly preventable but very common cancer. As for that digital screening, get over it. It's just an index finger. In Bakersfield, Robert Price, 17 News.